Okay, let's start. Okay. Good evening, everyone.
Good evening, I'm Jagrati.
And I'm Anna.
To every student joining us with hope, every educator joining us with purpose, every researcher joining us with insight, and every change maker joining us with courage, welcome. Welcome to From Silence to Solutions Youth Voices on Menstrual Health in Schools. Now, I would like to invite Ritika to share her inspiring work on Sarkari School, its vision, initiatives, and the impact it is creating in transforming government education. Please join me in welcoming her as she takes us through the meaningful journey.
All right.
Thank you. Thank you, Jagrati. Good evening, everyone. A very warm and heartfelt welcome to all of you joining us today in this Youth Summit on Menstrual Health. It is truly an honor to see such a diverse group of passionate people, educators, change makers coming together to speak on the subject that is both deeply important and honestly long overdue in our public education discourse. My name is Ritika, and I'm speaking to you today as the team lead of Sarkari School. At Sarkari School, we are a youth driven initiative working at the intersection of public education, policy research, and grassroots advocacy. Our mission is simple but powerful to strengthen public education systems in India by making them more informed, inclusive, and accountable. We believe that meaningful change begins when young people are not only passive recipients of uh, policies but are also active participants in shaping them. Over time, our work has focused on issues like equity, access, and social impact, especially in the areas of education and governance. And through research, content creation, and community engagement, we try to bridge this gap between policy and people. And most importantly, we function as a learning community where curiosity, critical thinking, and social responsibility come together. Today's summit reflects that very same vision. Menstrual health is not something that is inclusive to a women health issue. It encompasses education, dignity, and social justice. Yet, for far too long, it has been surrounded with silence, stigma, and misinformation. In many schools, young people do not receive advocate access and safe spaces to discuss menstruation openly. And this silence has real consequences affecting attendance, confidence, and overall well being. And through the summit, we aim to break that silence and move towards solutions that are empowered by young youth voices. And we hope to create a space that is, open to everyone. We aim to encourage people to share their lived experiences and meaningful ideas to change. We are especially grateful to our speakers, volunteers, and the organizing team whose dedication has made this event possible. And as we begin today's session, I encourage everyone to participate actively and share your perspectives freely. And let this not just be a discussion, but a step forward towards building more informed and empathetic school environments. Once again, very warm welcome to everyone. And we're truly excited to begin this together with you all. Thank you. That's it from my side. Back to you, Jagriti.
Thank you, Ritika, for shedding light on Sarkari School's incredible initiatives and for inspiring us with your dedication towards transforming education and creating brighter opportunities for younger minds. Today, we stand before you not just as moderators, but
To
as
every
young
student,
voices who understand why this conversation cannot wait. Because for generations, menstruation has been spoken about in hushed voices,
behind closed doors,
encoded language,
wrapped in secrecy,
and burdened with shame.
and today we are here to ask something simple yet deeply uncomfortable.
Why?
Why has something so natural as menstruation become something so difficult to discuss?
Why are millions taught silence before they are taught science?
Why are girls often taught to hide their periods before they are taught to understand them?
Why are young people expected to carry stigma that they did not create?
And perhaps, most importantly,
Why has society normalized discomfort around a process that is fundamental to life itself?
These questions are not just rhetorical,
They are real,
they are urgent
and for millions of students, they are deeply personal.
because menstruation is not just biology,
It is a lived experience.
it is checking your uniform in fear and anxiety.
It is the hesitation before asking for a pad.
It is the silence in classrooms where reproductive health is skipped, rushed, or avoided.
It is the absence of clean washrooms,
The fear of ridicule
the normalization of misinformation,
and the painful reality that for many, periods are treated less like health,
and more like something to conceal.
but silence has consequences.
Silence creates stigma,
Stigma creates shame,
and shame creates barriers.
and those barriers show up everywhere
In attendance sheets,
in academic performance,
in mental health,
in confidence.
and in opportunity.
When a student misses school because menstrual pain is ignored,
That is not inconvenience.
that is inequality.
When a child feels embarrassed for carrying a sanitary pad, that is not modesty, that is stigma. When menstrual education is treated as optional, that is not oversight, that is systemic failure. And that is exactly why today matters. Because today is not about pretending the problem does not exist, it's about confronting it, naming it, questioning it, and transforming it. This youth summit exists because change cannot happen where silence survives. And silence has survived for far too long. For too long, menstruation has been treated as a side issue, when in reality, it intersects with education, public health, gender equity, social justice, and dignity. Menstrual health is not a niche concern, it is a foundational concern. Because schools cannot be truly safe spaces if students are forced to navigate shame within them. And education cannot truly be equitable if biological realities become educational disadvantages. Today, we gathered because youth voices are essential to changing this reality. Not later, not when we are older, not when someone else gives permission. Now, because youth are not simply inheritors of broken systems, we are challengers of them. We are not here to politely accept harmful norms. We are here to interrogate them, to ask why shame exists, to ask who benefits from this silence, to ask why policy often lags behind lived reality, and to ask how we can do better. Because we must do better. And not only for ourselves, but for every student who has ever felt isolated, every girl who has missed class, every child who has been denied information, and every young person who deserves dignity without condition. Today is about replacing shame with knowledge, fear with confidence, whispers with advocacy, and silence with solutions. But let us also remember breaking stigma is just not about speaking louder, it is about speaking smarter, with empathy, with evidence, with policy awareness, with inclusivity, and with the courage to challenge not only institutions, but also everyday attitudes. Because sometimes stigma is not only written in policy gaps, it is embedded in jokes, in silence at home, in shame based traditions, in school environments, and the normalization of discomfort. So today, we do more than host a summit. We create a disruption, we create dialogue, and we create space for stories, for research, for solutions, and for leadership. Because leadership is not only about authority, it is about responsibility. The responsibility to challenge silence, the responsibility to educate, the responsibility to advocate, and the responsibility to imagine systems that serve everyone better. To every participant here today, your voice matters, your ideas matter, your lived experiences matter, and your courage to engage in this conversation matters. Because every meaningful social transformation begins the same way. Someone decides silence is no longer acceptable. So today, together, let us decide that silence is no longer acceptable, that shame is no longer acceptable, that exclusion is no longer acceptable, and that stigma has no place in the future that we are building. Let us build schools where dignity is standard, policies where menstrual health is prioritized, communities where education replaces taboo, and conversations where honesty replaces fear. This is why we are here. This is why this summit matters. And this is why youth leadership is not optional, it is essential. Thank you for being here. Thank you for listening. Thank you for caring enough to question. And thank you for believing that real change begins when voices rise. It is now our immense honor and true privilege to begin this summit with our inaugural address. Please join me in warmly welcoming Anam, whose words and leadership will help guide today's journey from silence.
To solutions. Let's talk about the rules now. To ensure our 27th speaker marathon remains impactful, professional, and seamless, all participants are required to follow these expanded guidelines. Your questions must be concise, concrete, and relevant to the topic. Answers must be relevant to the topic. Questions must be concise, relevant, and relevant to the topic.
Anam,
To,
I
to
don't, I
ensure
don't think you're
our
audible.
26
To the other 20,
to
student
Anam,
leader or
ensure
moderator
our
who raise
26
within the next one. Right. Shouldn't reach 4 minutes. Twinkle will call out your contacts and the respective speaker. When the moderator introduces you, begin immediately. Do not spend excessive time on long formal greetings. Dive straight into your core message. Ensure light is hitting your face, not your back. Position your camera at eye level and avoid ceiling shots. See your eyes and expressions clearly. Use a clean, neutral background. Avoid virtual backgrounds unless they are high quality, as they can sometimes cut off your features during the movement. Do not read from a Word document or paper. Use bulleted cues if you need reminders, but speak directly to the camera. Authentically moving people, scripts do not. Maintain a respectful, inclusive, and professional tone. While the topic is personal, avoid graphic medical descriptions that might trigger platform censorship filters. Stay on mute the entire time you are speaking. For even a small cough or a dog barking, can pull the active speaker focus away from the person presenting. Even when it isn't your turn to speak, keep your words or reactions short. Show solidarity with the fellow speakers. Use the Zoom chat, however, refrain from side conversations that might distract the moderators. If your internet cuts off, do not panic. Rejoin the link immediately. The moderators will move on to the next speaker and come back to you once you're visible. We encourage you to take a selfie with the Zoom screen and post it onto your social using the hashtag to amplify our reach.
Okay, that was really great. Thank you so much, Anam. Let's now call upon our first speaker of the evening, Arti Dangi. Arti Dangi is a menstrual wellness therapist and founder of Yoga Heart, dedicated to helping women overcome period pain, PMS, PCOS, and hormonal imbalances naturally. With over a decade of experience, she blends yoga therapy and science backed methods to support young women's health. She also leads corporate wellness programs and awareness sessions, empowering women to achieve pain free cycles and balanced, healthier lives. Let's all welcome her.
ma'am, your mic is muted. Ma'am, you are not audible.
Okay, okay.
Yes, you
Thank you.
are.
Thank you, Jagrati, and thank you, Anam, for having me here. And good evening, everyone. Special thanks to Sarkari School for having me here and giving me this opportunity to talk about less spoken but very important aspect of women's life among this community. Before I introduce myself, may I request you all to close your eyes for a moment and think of a woman you admire most. She could be your colleague, your friend, your mother, or even yourself. Now imagine she smiles at you in a conference room, but what you don't see is the invisible load she's carrying, the load of painful periods, stress of delayed periods, the fatigue during periods, or the fear of heavy bleeding. Now open your eyes gently. You could have felt all the emotional toll she's carrying. In my 7+ years of work in the field of menstrual health, the most common phrases I have heard have been, I thought this was normal. I have assumed this is my fate. And I have accepted that my calendar has less number of days. These phrases actually shook me deeply, and I went more and more deeper into the field of menstrual health. Many of you would have noticed that if you have any kind of menstrual disorders, you tend to gain weight, and if you are overweight, there are high likely chances that you may have some or the other kind of menstrual disorder. So, in order to break this vicious cycle and manage your menstrual health and weight naturally, I have come up with a system called Break the Cycle, which is based on four main pillars of lifestyle. First, exclusive yogic therapy, which is why I have separate batches even in menstrual health for different menstrual disorders. Second, your plate plays very important role. So we talk about diet. Third, sleep. And fourth is social connect. So I'm Aarti Dangi, menstrual health therapist and founder of Yoga Heart. With more than 1,000 success stories, actually, these stories remind me that when a single woman stands tall, she lifts everyone around her. This work is not theoretical, it's transformational. I have watched women go from I can't to watch me. Today's provided window is actually very small to talk about this critical topic. So, this has been me, Aarti Tangi from Yoga Heart, the woman who said, your period pain is not normal. You do not have to suffer alone. Remember these words. The more we talk about menstrual health, the more solution we bring to schools, colleges, workplaces, and community like this. So, as we move forward, I would request you to return to the women you pictured at the beginning. Promise her that you will help her in breaking the silence. Thank you.
Thank you so much. We truly appreciate your time, wisdom, and the meaningful insights that you've shared with us, Aarti. Let us now have Ananya Avasthi. She has a BA in Political Science from Delhi University and a Master's in Public Policy from RMIT University, Australia. She has worked as a policy advisor and a mentor at FOR Australia and as a lead policy analyst and project officer at St. Kilda PCYC till 2025. In 2022, she was a research officer with the Aam Aadmi Party. She has also been active in volunteering through the National Service Scheme, including as Vice President, Universal Peace Federation, Refugee Migrant Children Center, and Sangini Saheli Foundation. She received the Youth for Service Award from the Universal Peace Federation of India. Please welcome her.
Thanks, Jagriti, for such a wonderful introduction. And hi, everyone. First of all, I would like to thank Sarkari School for having me here and giving me the opportunity to contribute to this summit and talking about something which was long overdue, just as Ritika mentioned. All right, my name is Ananya, and I'm a policy professional based in Australia. I am a social enthusiast, particularly passionate about women's empowerment and youth justice, and have worked across the sector as a policy advisor and policy analyst with youth focused organizations. I feel truly honored to be part of this summit and to be able to contribute in any capacity. But before I speak as a policy professional, I want to speak as someone who lived this. I went to an all girls school back in India, and not once were we educated about menstruation early on. It was always done in secrecy, in hushed conversations behind closed doors. Something so natural, so universal, treated as though it was something to be ashamed of. And if that was the experience in a girls' school, a space that should have been the safest place to have this conversation, I can only imagine what it looks like everywhere else. That personal experience is what drives everything that I do in this space today. A girl missing school every month, not because she doesn't want to learn, but because there is no pad, no private toilet, no one she can talk to without shame. The research tells us that 24% of schoolgirls in India do not attend school during their period. That is not a hygiene failure, that is an education failure. And on the 30th of January, like while doing my research, I just came across that the Supreme Court of India finally called it what it is, a rights failure. In Dr. Jaya Thakur versus Government of India, the court held that the right to menstrual health is part of the right to life under Article 21 of the Constitution, ruling that lack of access harms the dignity of girl child. This is historic, but judgments don't build toilets, judgments don't remove stigma, implementation does. And that is where we must show focus now. Today, I would like to shed some light on three solutions grounded in what already exists in India and what needs to urgently follow. I understand and know for a fact that there might be many more solutions present, but we need to start from somewhere. Therefore, I have narrowed it down to just three. First, being that we already have a national policy, we just need to make it real. So, in November 2024, again, the Union Health Ministry approved the menstrual hygiene policy for school going girls following years of advocacy, of course. And this is the foundation, but the Supreme Court itself has questioned whether this policy accounted for ground realities, especially in tribal and rural areas where implementation gaps remain acute, and having a policy on paper is not enough. We need mandatory reporting at the school level, similar to how midday meals are monitored, so that every school is accountable for whether pads are available, whether toilets are functional, whether a trained staff member exists to support students. And at the end of the day, what gets measured gets done. Moving on, the next thing is include everyone in the conversation. It is not just for girls, it's for everyone, literally everyone, and especially boys. The Supreme Court's judgment was clear. Excluding boys from menstrual health education only breeds stigma and myths. The court directed that NCRT and SCRTs integrate gender sensitive lessons about menstruation into classrooms for all students, with teachers brought along too. We have a model that shows this works. And in Tamil Nadu, the Happy Periods program run by Sanitation First in government schools since 2019 includes co-educational classes on puberty and menstruation alongside wash improvements and teacher training. But the only thing is that
I'm
it
not
needs to be scaled
sure.
nationally. And third, trust the people already in communities. So we have the judgment, we have the policy, we have the programs that work. What we need is youth at the table, not as beneficiaries waiting for the system to act, but as advocates holding it accountable. And at the end, I would just like to say that because silence was never acceptable and solutions are no longer optional. Thank you.
Thank you so much for that. That was really good. That was a great speech. Thank you so much for your powerful thoughts and contributing so beautifully to today's discussion, Ananya. Now, I would like to invite Pooja Rajpurohit, a history graduate from St. Teresa's College, Kerala. With a strong interest in public policy, sustainability, and climate action, she has been part of the Climate Collective's Fellowship for Women in Energy. Her academic and leadership experiences make her a powerful youth voice. Please welcome her.
Am I audible?
Yes, you are.
Yeah, yeah.
So good evening. My name is Pooja Raj Purohit, and I'm here to talk about menstrual health. So before starting this, let me ask you a question. What's difference between sympathy, empathy, and apathy? Okay, I will take the example as natural as menstruation. Um, like if you're surrounded by a person, a girl who is suffering, like not suffering, like who is on her periods and like suffering from menstrual pain and all, आप बोलोगे कि बेचारी लड़की उसको दर्द हो रहा है, poor girl, like that's like sympathy. Empathy, like feeling yourself in her own situation, comparing yourself with that girl. Like in this case, many people help them. Uh, they like help them with proper menstrual products like sanitary pads, what do you say, menstrual cups, and providing them access to clean toilets, etc. And apathy, majority people of our society, which just ignore this stigma and let it go. They ignore people. They don't do anything. This is where we create the discomfort, the silence of this topic, menstruation. So what does it cost? It cost the girl to break her confidence. She will be like her future opportunities are like broken. She has no uh, that confidence level in herself. So I'm saying that majority of our what do you say, majority of our society is still in that era, like following that, considering menstruation as a taboo or a stigma. So we should have a facility to access all the people in this topic, menstruation, like including males, boys, every community in this, so that we feel like safe, and making this topic a familiar and a normalized topic and conversation, make it a like a better conversation between people, and a comfortable space around the women in our country. So I want to say that according to the evidences I have seen, like UNESCO and UNICEF says that one in every five girls in India misses their schools during their menstruation. Also, a foundation, NGO named Dasra, found also that 23 millions of people, young female people, drop out of schools after they hit their puberty. There is no proper, what do you say? There is no proper access to clean toilets, proper functional sanitization in rural areas, which also affect their menstrual health and hygiene, which are basic necessity for a girl. Uh, and also, a report by the National Family Health Survey says that 64% of young girls in our country are only uses correct, what do you say, safe hygienic menstrual products, while others are still relying on unsafe hygienic non-hygienic products. So we should have something, uh, what do you say, exposure to the people, to spread awareness, to spread education on menstrual health, converting policies into realities. Many policies are there which are still
Kindly summarize your speech.
sorry.
Kindly summarize your speech.
Okay, so at last, I want to say that just spread awareness, including vast diversities, different communities of our society, and making this topic normalized, and also proper exposure to the health and hygiene, menstrual health and hygiene for the young girls in schools, and also providing them with safe uh, products. Thank you.
Thank you so much for that wonderful address and for motivating us with your thoughts, Pooja. Now, I invite Soha Rahil Khan from Aligarh Muslim University, specializing in political science with a focus on international relations and human rights. Her academic journey reflects a deep understanding of governance and social justice. She brings thoughtful insights on important global and social issues. Please welcome her.
Am I visible?
Yes, you are.
Yes,
Thank
you
you,
are.
Jagriti, for introducing me. Means a lot. So let's start. From silence to solutions, making menstruation every girl's fundamental right. Hello, everyone. My name is Soha Rahil Khan, and I am an undergraduate from Aligarh Muslim University, Uttar Pradesh. And I'm truly very honored to be the part of this youth summit as a speaker, because this is exactly the platform, the conversation we Indians need to have loudly, openly, and without any shame. So let me begin with something small, which we all have seen or must have witnessed, but have never said out loud, or might have said. It's based on my experience. So I'll just say that a girl walks up to a shop, she asks for a sanitary pad, and without any word, it gets wrapped in a black polythene, tucked away like a secret, and she takes it quietly. And we all pretend as if we have seen or we have saw nothing, right? So this small movement basically tells us everything about where the India stands, where our society stands on menstruation today. So let's talk about what menstruation is. Like, what is menstruation? Simply, menstruation is not a disease. It is not an impurity, but it is a biological process which is experienced by over 355 million people in India every single month. And yet, 71% of the adolescent girl in India remain completely unaware about it, or until they have experienced it for the very first time. Again, every month, 25% of the girl they miss their school, and 23 million girls are drop out of the school or the education system because there is no accessibility to the sanitary products or the menstrual education, right? And there is the health of the menstruation, which contributes to over 70% overall in specifically in India. So these are not just the numbers, this is not just the data, these are the girls with dreams whose future are being quietly sacrificed one period at a time, right? So I'm just wondering, like, if this is happening in our universities, big cities, so let's just talk about the villages. What about those places where no one is privileged? Like, we are privileged, but what about those who are not privileged, or who those don't know much about this, right? So as we all know, the Honorable Supreme Court has recognized the menstrual health as a fundamental right, and the Menstrual Hygiene Policy 2024 exists. But again, the question comes: the policy on a paper means nothing without a real ground level implementation. So here are my four solutions, which I guess everyone needs to hear. Very simple. Number one solution, that every school in India, large or small, urban or rural, recognized or unrecognized, must have free menstrual products, clean washrooms, disposable facilities, and private spaces, not just as a scheme, but as a right. Number two, a formally approved compensate period leave for girls who have severe medical conditions like PCOS or PCOD or etc. Because no girl should fall behind because her body needed the rest. Number three, mandatory menstrual health education for both girls and boys together. Because when boys understand the menstruation, stigma breaks faster than any campaign ever could. Lastly, the number four, government monitoring must extend to every school, not just in rural, but as not just in urban, but as well in rural, because especially the unrecognized rural institutions where the most girls are being left behind, completely behind. So I just want to say that menstruation should be discussed in the classrooms, in homes, in policy rooms, not as something scandalous, but something as human, something real, something every girl deserves full support for, because menstruation is not the problem. Our silence is. And today we break it. Thank you.
Thank you so much for that. We really appreciate your perspective and the energy that you brought to this stage, Soha. Next, I invite Janvi Vyahriti from Andhra Pradesh, currently working as a fundraiser with Live for Cause Foundation and a writer with the Borgin Project. With her involvement in NCC and creative pursuits, she represents dedication and social commitment. Please join me in welcoming her. Uh, Janvi, is there something wrong? Okay, I think there seems to be a technical issue, and so we're just going to move ahead and we'll move back to Janvi when her issue gets resolved. Okay, I would like to invite Aditi Bhavsar, a political science student from Maitri College, University of Delhi. She actively contributes as joint secretary at Sankalp organization and works in media and event management. Her leadership and enthusiasm make her an inspiring youth voice. Please welcome her.
Am I audible and visible?
Yes, you are.
Okay. So, yeah. Good evening, everyone. Thank you for giving me this opportunity. It is an honor for me to be here today and sharing my perspectives on a topic that is not just a policy issue, but a matter of dignity, equality, and fundamental rights. A girl in India misses 50 to 60 days of school every year, not because she wants to, but because she is menstruating. This is not just a personal issue, it is a systemic failure. On January 30, as we all know, the Supreme Court of India recognized menstrual health and hygiene as a fundamental part of rights to life, equality, and education under Article 21 and 21A. But the real question is, are these rights actually reaching to every girl? Ground realities are different. When I was researching for this paper, according to the National Family Health Survey, although access to hygienic menstrual products has improved, significant gaps still remain, especially in rural and marginalized communities. This gap between policy and practice is not just about infrastructure, it is deeply rooted in our society. Menstruation should not be seen as a biological process, but as a natural and meaningful cycle of life, representing strength and continuity. Yet, due to social conditioning, it is often treated as impure or something as shameful. Education should not remain limited to classrooms. Children must take their knowledge to their home and start conversation with their parents and grandparents and help break long-lasting myths. In many parts of India, girls grow up with restrictions. They are told not to sit here, not to sit at that place, do not participate in some activities, and even the important decisions like marriage dates are sometimes planned around menstrual cycles. In rural areas, the challenges are even greater. Many women still do not have access to proper washroom. And even when facilities exist, they are discouraged from using them during periods due to cultural belief. Because of lack of access and awareness, many still rely on unsafe alternatives like cloth or other materials instead of sanitary pads, which can lead to serious long-term health problems, which has been normalized in because what has been normalized is not always what is right. At its core, the problem is silence and stigma. As we all said, we must ask ourselves a simple question: is menstruation a communicable disease? If not, why is treated with fear and exclusion? The answer lies in lack of awareness, and that is where change must begin. We must normalize menstruation, menstrual education in schools. It should be a necessary part of learning, not something optional or hidden. Both girls and boys should be included in these conversations. At the same time, we must think carefully about how we frame solutions. The idea of menstrual leave, although supportive in intention, can sometimes unintentionally reinforce the idea of menstrual leave, reinforce the belief that girls are weak. Instead of encouraging absence, we should focus on creating environments where girls can continue their education with dignity. A truly menstrual friendly school must ensure clean and functional toilets, proper water supply, safe disposal system, and access to free sanitary products. Because dignity lies not just in availability but in usability. We must also encourage a youth-led program in schools where school would have a menstrual ambassador programs which can empower students to spread awareness, support their peers, support their friends in school, and help in normalizing the conversation about periods. When young people take the lead, the change becomes stronger and more sustainable. Because when a girl can attend school with dignity, she does not learn, she grows, she leads, and she shapes the future. Thank you.
Thank you so much. Uh, Thank you so much for an engaging and thoughtful provoking session, Aditi. Now I will welcome Shreya on the stage.
Thank you so much. I hope I'm audible.
Yes, Shreya,
So,
you are.
hi, thank you. Hi, everyone. I'm Shriya, and I will be the next moderator. So, now I invite Rupama Sarkar, a student at the University of Calcutta and a content writer intern at Pehchan, the Street School. With a background in statistics and mathematics, she uses her writing to highlight social inequality and education issues. Please welcome her.
Yes, good evening, everyone. Thank you for this opportunity. I am Rupama Sharkar. So my topic will be, I'll be talking about the beyond access, the management of waste of menstrual hygiene products. Like we are working for raising awareness for the menstrual hygiene products, like educating people about using these products and increasing the mobility and raising awareness and distribution of the sanitary products. But there lays a significant issue that we are not much aware of the ways of disposing the items. Like every year, millions of menstrual hygiene products after usage they get fields in the landfill, thus creating a serious environmental issue or also the health consequences for especially for the sanitation workers who directly handles this waste. Like currently, we are running a supply management chain where we stop at the consumption. Thus, it creates a lack of a policy framework. So, I want to address this issue and want to talk about the waste management uh, methods. Like, firstly, I think that investment should be made on installation in this in decentralized waste management facilities in educational institutions like schools and colleges, and also in like public restaurant, like decentralized sanitary product incinerator, so that after usage the people can safely dispose these products, and it is also convenient to use and easy to access. But there also causes an issue that these incinerators, they release toxic fumes by the burning of the plastic, so that they can cause another environmental issue. So another approach can be shifted to like focusing on providing subsidies to reusable or biodegradable products, biodegradable sanitary products, which after use can be easily disposed, and they can easily disposed, and they can be mixed in the environment really easily. So it can also reduce the overall waste of the municipal waste and volume of the municipal waste, and thus leading into a more sustainable option. Also, some accountability should lies on the manufacturers. Like manufacturers can also focus on improving the designs and reducing the plastic usage of the product. Also, our awareness campaigns should not just stop at providing the access of the menstrual products. It should also go beyond and teaching people, educating them that how to dispose these items properly after usage. Like in many areas, like the rural areas, or where people are not so much, there exists a social taboo regarding this. So people are not very much aware of how to dispose them. Like even in many cities or urban areas, there is a lack of disposable option to dispose the products after usage, which creates a serious environmental issue, also the health consequences of the people. So I think this area should also be addressed, and um, should also be addressed, because for menstrual hygiene to be it more sustainable and inclusive, our focus should move beyond, and move beyond the access. Thank you so much.
Thank you very much for your insights and remarkable knowledge. It was truly enlightening. Next up, we have Sonakshi Singh, an aspiring law student at the National University of Juridical Sciences, Kolkata, with a strong academic background and a deep interest in legal studies. She is passionate about critical thinking and analysis. A published author at Apricus Literary, she enjoys writing, reading, and creative expression through art. Let's all welcome her.
Thank you so much, Shreya, for the introduction. And thank you so much, SarkariSchool.in, for giving me this opportunity to talk about something that's natural, something that half the population experiences, but something that is still treated like a secret in many schools, which is menstrual health. The moment I say periods in public places, a lot of people feel awkward. They may even giggle or look away. And that's exactly the problem. Menstruation is a biological process and not a joke, not a shame, and definitely not something to be hidden. Yet, in many classrooms across the country, it's often brushed aside. Just think about it. A girl gets her first period in school. She's scared. She doesn't know what's happening. Maybe she doesn't even have a pad. She misses class and feels embarrassed. She may even get teased about it, right? Should education really be interrupted by something so natural? No, the main challenges in this is that there is no proper education about menstruation. They hear myths like you shouldn't, wash your hair, go to religious places, and they don't even know what is it, right? Especially the boys. And the facilities in school are often inadequate. Imagine trying to manage your period in a school with no clean toilets, no disposable bins, no access to sanitary products. It's not just uncomfortable, but it's unfair. And then there's a lot of silence. We don't talk about it openly, right? If we treat it as ordinary, it will become ordinary. But the good news is that we can change this. First, education. Menstrual health should be a part of the curriculum itself. It should be taught openly to both boys and girls. When everyone understands, the stigma will fade. Just one second. Sorry for that, I have a bad throat. Now, second is facilities. Schools must provide clean toilets and disposable bins, right? There should be affordable sanitary products. Actually, they should be provided freely. And no student should have to choose between attending class and managing health. And the third is normalization. We, the students, can play a good role in this. Talking about periods should be as normal as talking about anything else, like exams or sports. And let's not forget that menstrual health is not just about hygiene, it's about dignity, equality, and opportunity. When schools support menstrual health, they empower girls to stay in class, to feel confident, and to thrive. So, my message is let's break the silence, let's pledge to educate, to support, and to normalize because menstrual health in schools is not a privilege, it's a right in itself. Thank you so much.
Thank you so much, Sonakshi, for sharing your experience and for making your session so enriching for all of us. Moving on, we have Muskan Jain, who is pursuing her master's degree in public policy and governance from the Tata Institute of Social Sciences in Hyderabad. She has a bachelor's degree in English literature from the University of Delhi. Her work of area is at the intersection of policy research and governance. She has a strong background in legislative and policy research, having worked with the Jammu and Kashmir Legislative Assembly and with the Artha Research and Intelligence Lab in 2025. Please welcome her.
Good evening, everyone. Am I audible?
Yes, you are.
Thank you, Shreya, for introducing me. I'm glad to be a part of this conversation today. I am Muskan Jain, and today I want to talk about something that often gets left out when we talk about menstrual health. So, at a stage when girls are just beginning to understand their bodies, conversations about menstrual health become very important. Yes, building the right kind of infrastructure matters. Yes, addressing the stigma around it also matters. And the speakers previous to me have done a great job addressing the comprehensive aspects of it. But I want to talk about PCOS, polycystic ovarian syndrome. I'll begin with my experience. So, when I was at school, I had acne that would never go away. My periods almost never came on time, and my facial hair made me very self conscious. But I did not know what was wrong. I thought that this was just normal. It was much later when I was in college that I was diagnosed with PCOS. And at that time, I began blaming myself. What had I done wrong? Why was it happening to me? It was only because no one had told me what to look for, right? Um, so, according to statistics, almost 1 in 5 Indian women suffer from PCOS. Yet, many girls don't know what to look for as early signs when they occur. When they first appear. And when you're young and you don't understand why your body is changing differently than others, you blame yourself. You begin to feel something that it is wrong with you, and it affects confidence. Sharing something personal, before I go to any public event, I usually remove my facial hair. And this is something that I have done over the years without even thinking about it. But today I decided not to. I'm not sure if it's visible, but it is there. Because I decided that this conversation required honesty, and I didn't want to talk about accepting our bodies without, while hiding mine. So, anyway, coming back to the topic, what the schools can do about addressing PCOS. I came up with 3 solutions which are practical and implementable at school level. Schools can teach girls what a normal menstrual cycle looks like and what is not normal. Things like what is a normal cycle length, what kind of pain is expected, and when is irregularity a warning sign. They can also organize one honest conversation with a doctor each year, where students can ask anonymous questions like, why is there hair on my chin? And why does my period hurt so badly? So it costs almost nothing, but it can change everything. The second thing that schools can do is to introduce a menstrual tracking calendar printed at the back of the school diaries itself. Girls can quietly mark their cycles and note anything unusual over time, just to notice patterns. If something needs attention, a counselor or nurse can guide the student privately. Honestly, it's the kind of system that I wish I had when I was 15. And the third thing that schools can do is to talk about prevention. Many girls don't realize that their everyday habits like skipping sports, which is very common in schools, irregular eating, or even lack of sleep can affect their hormonal health. Even simple guidance about staying active, eating regularly, and nutrient rich food can help girls manage conditions like PCOS much earlier. Menstrual health education should not stop at teaching girls how to manage their periods. It should also teach them how to listen when their periods are trying to say something. This is the missing link, and schools are exactly the right place to address it. Thank you so much.
Thank you so much for such an empowering address. And I'm sure that it resonated with a lot of people over here. Moving on, we have Arthi Rajpurohit. She's a history graduate from St. Teresa's College, Ernakulam. At present, she is a research fellow at Climate Collective, where she is actively contributing to climate centered research projects and initiatives. Arthi has also been associated with many internships that have helped her gain significant experience working on governance and sustainability projects for organizations such as Nyay Niti Policy Collective, Kochi Municipal Corporation, and SLATE. Please welcome her.
Hello, good evening, everyone. Respect organizers and the fellow speakers, all of you present here. Hi, I'm Adi Rajpurohit. I am a history graduate and certified in public policy and a social enthusiast. Like, I'm here to talk about something which is often affects millions of people, but almost it is kept in silence, which is about menstruation education in school. I think like menstruation is a natural biological process. Menstruation is not a problem, but silence around menstruation is a problem. Like I have experience during our schools, we had a session on menstruations. Only girls were called, not the boys. This is the stage where misinformation and misunderstandings creates among boys about menstruation. I think equal opportunity should be given to boys and girls to learn about menstruation. According to UNESCO and UNICEF, as all of us said before, like 1 in 5 students, each of them misses their schools due to parents. That is almost 25% of students. And like according to like Supreme Court, it is now treated as a fundamental right. I think this is not a health issue. It is an educational issue. It's a human right issue. It's about equality. It's about dignity. And here I have like seen like 3 challenges which are faced by school students, female students. First is the lack of awareness, like as I told before, said before, like no proper education is given on menstruation to boys and girls equally. It should be given. This is their right, and due to if they're due to this misunderstanding won't be created. And second one is the proper sanitization. I have also experienced there is no proper sanitizations in schools, like no clean colleges, like toilets, proper disposal area, and water supply. I think this of this gaps have been filled by the government of India during the scheme of Swachh Bharat Abhiyan. And but I think some of the gaps aren't filled yet, and it should be addressed this problem. Third one is like limited access to menstrual products, like low income areas and rural areas. Some students are not able to like get this menstrual products because of their limited access. I have also seen like I use our yes, during my schools when I had periods, I used to give 8 rupees per pad. I think this is something not should be charged. It should be given a free of cost. We are not demanding for a basic necessity, like not demanding for luxury. It's our basic necessity, and we should be given. So like this is where, and like I have been involved in many projects, where we supported sustainable menstrual products, and like using pads, like it creates a way like a large amount of waste. So like we have distributed almost during our project almost 200 plus menstrual cups to the girls. And like we are the young students, like young youth, where we can make our voice be called, where we all come get together and make differences in our society. And this is not something shameful. It should be treated as respectful. This is not about impurity. This is about menstrual education, where we create a comfortable environment and a safer environment for students, where they can come and talk about this openly. Thank you.
Thank you so much for sharing your experiences. as also such an inspiring and impactful perspective. Next up, we have Sadhana Tiwari. Her work reflects a thoughtful blend of academic rigor and social commitment. Through her association with Pehchan, the street school, she has been actively involved in creating inclusive learning spaces for children who are often excluded from the formal education systems, contributing not just as a volunteer but also as a reflective voice that highlights issues like digital exclusion and unequal access to opportunities. Her writing and engagement brings attention to the lived realities of undeserved communities, making her impact both grounded and far reaching. Let's all welcome her.
Thank you, Shreya. Before I start my speech, I'm sharing something very unexpected. I'm actually on my menstrual cycle right now, and I couldn't help but notice how perfectly that aligns with what we are about to talk today. So let's start the topic. Greetings, everyone. I am Sadhana Tiwari, presenting my opinions on Sarkari School platform, which I am thankful to. So let me start with the numbers. Less than half of the girls in India, only 45%, know about menstruation before their first period. 1 in 4 misses every school during menstruation due to lack of facilities. Only 56% of schools have separate toilet for girls. Only 30% has proper disposable facilities. Nearly half lack basic hand washing facilities also. Only 7% girls report teachers as their source of menstruation information. Nearly half of schools don't provide emergency sanitary pads, and only 25% seek treatment due to shame when they face menstrual problems. And there's a massive regional divide. Usage of hygienic products exceeds 90% in Kerala, but remains below 60% in states like Bihar and Madhya Pradesh, which I belong to. So menstrual health in India is a system failure, which I mapped. It spreads across 4 clear gaps. Schools across India face a foundational crisis. Most lack clean toilets, safe water, hand washing facilities, proper disposal systems. Girls avoid these unsafe spaces, skip school entirely, or resort to dangerous alternatives. Without basic information, menstruation becomes a barrier to education itself. Even when girls have access to sanitary products, the problem persists. In Madhya Pradesh, for example, 82% of girls obtained pads, yet 37.5% still missed schools. This reveals a deeper truth. Products alone cannot solve what requires systemic change. Low-income girls continue using unsafe alternatives like cloth and ash, sands, because access without support feels hollow to them. Knowledge gap compounds this crisis. Menstrual health education purely exists in curricula, and teachers avoid the conversation entirely. Girls face their first period unprepared and confused, including my own self. When neither girls nor boys receive honest information, myths flourish and shame deepens. These barriers don't operate independently. They reinforce each other, creating a system where girls internalize the message that menstruation is something to hide about. This isn't about menstruation itself. It's about equality, opportunity, and dignity. 4 gaps. Millions of girls affected. But wait, is this a hopeless situation? Or are schools and governments doing something to fight back? And if they are, why isn't every girl benefiting yet? India has launched several national and state level initiatives to address menstrual health. The Menstruation Hygiene Scheme in 2011, the Rashtriya Kishore Swasthya Karyakram, etc. At state level, Kerala's She-Pad program, Odisha's Khushi program, Rajasthan's Udan program, and even Chhattisgarh's Suchita Abhiyan provides free or subsidized pads to girls and women. However, these initiatives face critical implementation gaps. Schools lack pre-service teaching training on menstrual health, and no monitoring system exists to track the implementation in schools. School management committees remain dysfunctional and unaware of their responsibilities. Most importantly, interventions are school centric, completely excluding the 26 million girls who are out of school, which includes child laborers, domestic workers, and the dropouts. The path forward requires strengthening existing initiatives while building the new ones. First, every school needs functional wash infrastructure, separate toilets with locks and doors, clean water, soap, hand washing facilities, etc. As laid by the Ministry of Drinking Water and Sanitation Guidelines 2015, but the implementation compliance lacks. Second, menstrual
Sadhana,
health education must be integrated into school curricula as a mandatory
Sadhana,
component. And yes, ma'am.
kindly summarize your speech.
Just doing that. So teachers need pre-service in service education. Third, school must establish functional school management committees. Fourth, for every out-of-school girls, menstrual health awareness must be integrated into the panchayat meetings, like that of Andhra Pradesh's Sesha initiative. Fifth, stigma reduction. Sixth, decentralized innovation should be encouraged, like states like Kerala and Odisha have done that. Finally, school-based management information system (MIS) is essential. So, concluding all of this, nearly 243 million adolescents live in India. Out of 117 million are just adolescent girls. We have mapped the problem. We have seen the solutions. So, are we ready to demand it? We are the generation that can make this happen. The silence ends here. The change starts with us. Thank you.
Thank you very much, Sadhana. We deeply appreciate your presence and the knowledge and perspectives that you have shared so generously with all of us. So now I would like to pass on the moderation torch to Anam. Please welcome her and thank you, everyone. Over to you, Anam.
Anam, you are muted.
Around menstrual health awareness and women's mental health. Her work goes beyond clinical knowledge as she actively engages with communities through initiatives like Project Jagriti in collaboration with Voice for Welfare, conducting on-ground sessions in undeserved areas and bringing attention to the lived realities of women, often excluded from the mainstream health discourse. Let's welcome her.
Good evening, everyone. To all the panelists, organizing committee, and everyone present, I'm Dr. Akshita. I want to start with a question to everyone today present in the panel. What was your first period experience like? I ask this question every time I sit down with the women on ground, and often the answer is always the same, like fear, discomfort, guilt, often also quoted as something is wrong with me, something bad has happened. And when I thought to myself, despite having the knowledge and awareness around me, I still remember the panic that I had in my own body, uh, like that nobody actually prepared me for. Because there is a difference in knowing something exists and actually being ready when it actually arrives. So menstruation for the longest time wasn't something we were taught. It's something we figured out quietly, often scared and alone. So during one of my ground sessions, I met this girl who had been abandoned by her family and is brought to a shelter home. She had irregular periods. Her family, because no one had ever explained them what irregular periods mean, assumed that she was pregnant. In reality, she wasn't. But she had already been removed from her home, isolated, abandoned, because silence filled the space where knowledge should have been. So that girl is why we need implementation, and implementation shouldn't be waited. We have a policy that is itself is a progress, but there is an execution gap, and I personally feels it is at three levels: at the school level, at a health level, and at a community level. Initially at the school level, I propose a menstrual health coordinator, a trained teacher who is always available and is accountable every single month, so that they ensure that school is menstrual friendly. There's a private washroom with running water, separate disposal bin that is emptied regularly and is functional every single day. They are responsible to run monthly session among students, starting with what is menstruation, to how to track cycles, what is a normal cycle, what is abnormal cycle, and also conduct events regarding menstrual health and hygiene, and maintain all the record of these events, and also plan the events. And someone whose door is always open, like the students can approach them both in doubt and when in need. So they should also ensure that they have a peer monitor in every class and ensure that pads are always available. And we should also put a conscious effort to include menstruation in the curriculum, not as a poster in the wall that is, appears during inspection and, disappears the next day, but in more ways that is woven into the students actually learn, like a guide in a textbook introduced gradually from a very young age and reaching every student, including boys. And now at the health level, I want to talk from a doctor perspective. Mostly we were told girls should cramp should be tolerated, सहना पड़ता है, but it tracks back to anemia and iron deficiency, which is often ignored when very young, and a girl with low iron was never addressed, and this becomes a woman whose body cannot withstand a delivery table. So I propose ASHA workers who's already trusted in this community need to be brought into this loop and monitor levels, ensuring supplementation to all the girls present in these age group, and also include menstrual nutritional intentional nutrition to menstruating girls body in the midday meals program. And through these levels, a girl we should also include girls with disabilities, because they have to be given additional care and included in the system, because they are often the ones who are like neglected or not thought about. So I propose a coordinator accountable for every month, washroom that works every day, curriculum that prepares instead of surprises, a community that talks instead of silences, a ASHA worker who notices, a system that includes every girl, including the one we most always forget, because the goal is at least the next generation. Menstruation should not be a hushed reality, but a lived experience that builds confidence, dignity, and self trust in every girl, because menstruation shouldn't be a privilege, it's our fundamental right. Thank you, everyone. Thank you for this opportunity.
Hey, thank you for such an insightful session and for inspiring us with your journey, Dr. Akshata. Let us now have Thank you. Let us now have Sakshi Sharma as a dedicated policy advocate and researcher with a focus on social impact and sustainable development goals, which are SDGs. Currently serving as a policy and advocacy intern at Sarkari School, she has built a very strong foundation in analyzing all grassroots educational frameworks and employment. With a background in teaching and curriculum development, Sakshi excels at translating complex policy ideas into actionable community engagement. Let's all welcome her. Dr. Sakshi, stage is yours.
Thank you so much, Anam. Thank you for the introduction. Just a bit correction. Currently, I am working as a Gandhi Fellow with Brahmal Foundation. Yeah, so thank you so much. Starting with this bits of story. A girl who is going to her work in a field and is with three males as her co-passenger and as her co-fellows, and suddenly got a period in a road on a highway where there's no public toilets, there's are no houses, there's no mall, there's no school nearby, there's no village nearby, and doesn't know what she needs to do. And you know what's surprising? She is a master's from University of Delhi. She belongs to a place and she lives in a house where periods are talked. She can openly discuss these things, and still she is in a confusion. She is in a silence that she is not able to speak about periods. And that's where's the problem arise. The problem is silence. The problem is our silence. The problem
that we are not able to talk about our periods, we are not able to talk about our hormones. We are saying that menstruation needs these things, these infrastructural barriers are there. We are saying that there are economic hurdles among the girls, but we are not saying the very basic thing, and that is that it's our silence. It's the missing men in mensuration. Like it's in our session only, we have only one man in our session who is speaking here. And so from my side, a round of applause to the person, Abhinandanji, for coming and speaking here about a topic which he thinks that is related to him also. It's not about getting period, it's about understanding it. And when we will break the silence, we will talk about our hormones, we will talk about our periods, then only periods could be, we will be able to include that in the education. How, see, we are at a level, we are working at different levels, we are working in different programs. Someone is here teaching yoga and all, so they are doing that. But if we are not even able to tell that I am suffering from this, I have this problem, I am getting irritated with your sound because I am in periods. It's not because you are talking so loudly, it's because I'm in periods and that's why I'm getting irritated. We need to address these things, and that's where we need to break the silence. The second most important thing is that definitely needs men's in mensuration. So I was telling the story in the very start, and when the girl broke her silence, the three of the men came as her supporters. They immediately found a place where she could use a pad, and that was not a bathroom, that was just behind a tree. And that's because of the people she was able to do that. They gave One of the men gave her the jacket, and when they reached the market, the other bought an ice cream. So we need men's in mensuration. We need some open talk. So yeah, definitely mensuration in schools is a real problem. And working here in aspirational block, I can definitely say that there are many schools who doesn't even have, which doesn't have washrooms. Not even girls' washroom. Leave the thing with the boys' washroom. That's a separate thing to talk about. So infrastructural barriers are definitely there, economic barriers are definitely there, but it's not like that we don't have models. We do have models. We have the models where we can mm, where we can came out of these infrastructural barriers, like the education model from the Andhra Pradesh, the Swechha initiatives, where in Anganwadi centers menstrual hygiene workshops are conducted. Infrastructure models like of Kerala, where she had program has been successful in deploying um, sanitary pads, vending machine, and proper incinerators. The economic model of Madhya Pradesh, where self-help groups with ASHA workers manufacture sanitary pads, and obviously we all know about the famous padman. So yeah, summarizing my speech, definitely after this uh, 30 Gen ruling from the Supreme Court, we do have the constitutional entitlement towards mensuration. But what we need is we need substantive equality. We need to accommodate the specific things, that we are equal but not identical. And then only by breaking our silence, including men's in mensuration, we will be really able to uh, we will be really able to empower youth. We will be really able to advocate youth for menstrual health in our Indian schools. Thank you so much. That's it.
Okay, thank you for encouraging words and thoughts, actually. Let us now have Abhinandan call, law student at the Faculty of Law, University of Delhi. With an academic background in history and political science from St. Stephen's College, he currently serves as a media president of the Delhi University Students' Union (DUCSU) and is an anchor of Doordarshan. Abhinandan is the founder of Young Sapiens Network, a platform fostering dialogue and collaboration among young people, and has worked with Global Youth India and the Policy, Politics and Governance Foundation, reflecting his sustained engagement with policy and governance. Over to you.
Thank you, Anam. Am I audible?
Yes, you are.
Yeah. All right. So good evening to the organizers from Sarkari School and the We Citizens Foundation, all the distinguished panelists, and all of those who are watching us online on YouTube and other platforms. I'm Abhinandan Kaul, and Anam has already introduced me. So it's a privilege to be part of this discussion that sits at the intersection of education, public health, and gender equity. But yet, it's such a discussion that for very long it has remained on the margins of all of these three. So let me begin by reframing this particular issue. Mensuration in itself, we all know, is not the problem. I mean, all of us know that that's not the problem. The problem is that the environment around mensuration, the infrastructure, the information, and the institutional response. And when the ecosystem is weak, the consequences are not abstract; they are measurable. So, data from UNICEF and India's National Family Health Survey, it points out to uneven access to menstrual hygiene facilities, particularly in government schools and in rural areas. And many estimates they suggest that millions of girls in India they face disruptions in schooling, and a significant portion either misses classes regularly or disengage altogether once they begin menstruating, as has also been pointed out by the panelists who spoke before me. So it's important now to understand what this disruption actually means. So it's not just absenteeism, just for a few days a month. It sort of compounds over time into learning gaps, into loss of confidence, and in some cases, permanent dropouts. So when we talk about menstrual health in schools, we are not just discussing a welfare issue, we are discussing the integrity of our entire education system itself. So if we examine this issue closely, there are around three structural gaps that become evident. So the first gap is that of infrastructure. So there's a large number of schools that still lack what would qualify as minimally acceptable sanitation. Many speakers before me pointed that out. We lack functional toilets, reliable water supply, safe disposable mechanisms, and so on. And without these, even the most well-designed awareness programs, they'll collapse, at the point of implementation itself. So a student cannot translate awareness into practice if the environment around that student doesn't permit it. Now, the second gap that we see is about access. So while policy efforts in India, they've expanded the availability of sanitary products, the access of those sanitary products, the access remains inconsistent. In many cases, now the access is dependent on geography, on administrative efficiency, and so on. And this sort of creates a situation where menstrual hygiene it becomes contingent rather than guaranteed. And then the third, and I believe the most underestimated, is the gap in information and in social conditioning. So menstruation, it continues to be framed in silence. Students are expected to just figure it out rather than comprehensively understand it. Boys are almost excluded entirely. I mean, one of the speakers before me, Arti, she pointed out that only girls. There was in our school there was a session on menstruation, and only girls were called. And there was another speaker who before me who said that there's only one male student, one male speaker in this entire panel discussion. So I mean, if boys are excluded, then the stigma around menstruation it's not reduced, but it is reproduced. And then moreover, teachers often are not equipped with either training or the institutional backing to address this subject with clarity. So what should we do about this? I mean, a meaningful response would be one that recognizes menstrual health as a core component of school infrastructure policy and not an auxiliary concern. One response which sort of treats menstrual health as a policy priority that is backed by implementation and not just advocacy. So there are a few solutions. So first of all, I believe that we all know that India is not operating in a policy vacuum. We have the Right of Children to Free and Compulsory Education Act, which already mandates basic infrastructure norms, including clean toilets, separate toilets for females and males. So there's a foundation which exists. However, the challenge it lies in implementation and accountability. So, a school may technically meet the RTE norms, but in practice, the facility may be non-functional. There may be no running water, poor maintenance, or complete lack of, disposal systems. So, in such a case, the existence of the infrastructure doesn't translate into usability, and the right itself it becomes symbolic. So, this is where the focus must shift from formal compliance to verifiable real-time compliance. And one very easy way to identify this is by leveraging the digital public infrastructure that our nation already has. There are platforms like ANNAM, the asset mapping system, which are already used to geotag public assets. So they can be adapted for schools. And so every sanitation facility can be geotagged, photographed, and periodically updated so that there's a transparent kind of publicly accessible database. And this can also be supplemented by third-party audits and student feedback mechanisms. Then, when we see data is flowing through the administrative systems and also actual users, and that's the point when accountability becomes far more robust. And additionally, we can sort of link compliance of a school to accreditation or to funding initiatives, and this will sort of ensure that the standards are not merely advisory, but they are actually enforced. So this is one of the things that we can do. The second issue that I talked about was access. And here again, the challenge is not just intent, but is also consistency. So over the years, we can see that India has introduced multiple schemes to improve access to menstrual products, including providing subsidized distribution of sanitary pads through public healthcare systems, such as there's a menstrual hygiene scheme that's there. So these initiatives have had a great impact, measurable impact in increasing awareness and in the initial adoption. However, within the school ecosystem, I believe that access, it still tends to function through sporadic distribution drives, NGO interventions, or by one-time campaigns. So these are well-intentioned, but such models are inherently unreliable. They create moments of availability, but not the systems of assurance. And for something as regular and as predictable as mensuration, uncertainty it itself becomes a barrier. So what is required, therefore, is a shift from this event-based distribution to institutional guarantee. So in practical terms, that means that access to menstrual products, it should be embedded into the daily operational framework of schools. Just as a student doesn't have to wonder whether drinking water will be available or not, access to basic menstrual hygiene products should also be predictable. They should be stigma-free and immediately accessible wherever needed. So one way to operationalize this is through a school-based distribution points. For instance, having low-cost or free paid dispensing sort of machines that are placed in the female washrooms, or having designated health rooms where products are available without any kind of bureaucratic friction. But again, I mean, infrastructure is not alone sufficient. What makes this system sustainable in supply, it is the supply chain reliability. So schools can sort of be integrated into existing public distribution and health supply chain, and we can leverage networks that are already used for medicines, for midday meals, so that this restocking of the sanitary pads, it's automatic, it is tracked, monitored, there is proper accountability, and rather than some sort of ad hoc initiative, we can have a digital inventory system as well at the basic level. And at the same point of time, in this kind of initiative, there is also space to
Abhinandan,
innovate. Yeah. Yes, I'll just conclude.
kindly summarize.
Yeah. And so, as I was saying, I mean, in this space, there's also a sort of, place for innovation as well through localized solutions. We can encourage school clusters or districts to partner with women self-help groups for low-cost pad production, and that can ensure both supply as well as sort of create continuity, community ownership, and also, align with livelihood generation. And the third thing, I'll just briefly touch over that I had the challenge that I mentioned, and then the solution is about education. So the gap here, as we all know, speakers have pointed out that it's both curricular and cultural as well. So we need a very holistic kind of curriculum. Although we have books in in grade 8th, grade 10th, we learn about the reproduction system and so on. But most of us would remember that all of these chapters, they are very quickly skimmed through. So we need detailed kind of education on these critical issues. And as speakers before me pointed out, that boys are excluded, and there was a speaker who also said that there should be men's in mensuration. So that is something that should be introduced. And I mean, men and women both should be included in the conversation. If we are having a workshop, then male students should also be included. So inclusion, it sort of normalizes the subject, and it builds a shared baseline of understanding, making schools more respectful, and sort of helps in building supportive spaces for everyone. And finally, we must also create feedback loops within school, where students can articulate what is not working, what is working, so that the policies which are being implemented, they sort of become performative and are not just there in paper. So I would just like to conclude by making one distinction clear. The goal here is not simply to break the silence, because silence in itself is actually not the ultimate problem. The real objective is to build a system where silence itself becomes irrelevant, because the structures in place are already responsive, informed, and inclusive. We need a system where no student has to calculate whether attending school during menstruation is feasible or not, or no student relies on incomplete or incorrect information, and no school treats menstrual health as a sort of afterthought. And as Kofi Annan, the former Secretary General of United Nations, once pointed out, there is no tool for development more effective than the empowerment of women. So if we take this issue more seriously, then menstrual health in schools is not just a peripheral issue. As I pointed out earlier, it is foundational, concerning the entire education system of our nation. And addressing it is effectively not just good policy, it is a test of how seriously we take equity in education. So thank you so much. And I wish that such conversations keep moving on, and we sort of are able to tackle this major important challenge. Thank you.
Hey, thank you, Abhinandan, with like quite literally enriching us with your valuable experience. Thank you so much once again. Okay, let us now have
Anand, you are not audible.
Right. So currently pursuing an MA in political science and serving as an MPP intern at Manthal, she brings a high level of critical inquiry into the study of how political ideas, her professional development, is functioning. Her professional development is marked by prestigious selections, including McKinsey Forward 2026 and the Academic Leadership Program ALP 2026, reflecting her commitments to excellence in the public policy landscape. Let us all welcome her. Shubhangi, it's on you now.
Hi, Anna. Thank you for such a introduction, and I'm glad to be present on this platform and be part of this much crucial conversation along with other respected. And thank you for the Sarkari School team for bringing me here as well. So I would like to begin on this conversation with throwing up some personal views and some previous research that I was a part of, and begin talking about this. Uh, in India, today, a girl does not miss school because of her period. She misses school because the school was never designed for her. And that is not an individual problem, that is a systemic failure. We often celebrate increasing enrollment of girls in school. We talk about access, literacy, and empowerment. But we rarely ask a more uncomfortable question. What happens to a girl when she starts menstruating? Does the school continue to include her or quietly begin to exclude her? Because for millions of schoolgirls in India, menstruation marks not just a biological transition, but the beginning of educational disruption. Let us look closely at what the data tells us. According to NFHS 5, only about 77% of young women use hygienic menstrual methods, and this number drops significantly in rural areas. Now, place that reality inside a school. Official data suggests that over 95% of schools have girls' toilets. But this is where the illusion of progress begins to break. A large number of these toilets are non functional. They lack water, they lack privacy, and they lack basic maintenance. So, for a schoolgirl who is menstruating, this does not translate into access. It translates into a daily negotiation. Where can I go? How do I manage? What if someone finds out? And when there are no answers, she chooses absence. Studies estimate that up to 23% of girls drop out of school after reaching puberty. not because they want to leave, but because the school environment becomes unlivable for them. Now let us move beyond the surface. This is not just about toilets, it is about how policy understands or fails to understand girls' lived realities. India has implemented multiple schemes, the menstrual hygiene scheme, the Swachh Bharat mission, and awareness programs in schools. But despite this, the experience of a schoolgirl remains largely unchanged. Why, you ask? Because these policies are fragmented. Sanitation is handled separately, health separately, and education as well is handled separately. But as a schoolgirl, she experiences all of this together. And when the policy is divided, her experience falls through the cracks. There is also a deeper issue within. Our policies are designed in a technocratic way. We measure success by asking how many toilets were built, how many pads were distributed, but we fail to ask, can a girl actually use these facilities safely and with dignity every single day of the month? Because a toilet without water or without a door that locks is not just inadequate, it is exclusion built into infrastructure. This reflects something deeper about how systems are designed. As many feminist theorists like Marian Young has argued, most public institutions are built around a default male body, one that does not menstruate, does not require privacy in the same way, and does not face the same vulnerabilities. So when a school fails to provide menstrual-friendly infrastructure, it is not an oversight. It is a reflection of whose needs were never considered essential. And the consequences go beyond attendance. When a girl misses school every month, she falls behind academically. She loses confidence. She becomes irregular. Eventually, dropping out becomes less of a decision and more of a slow, forced institutional exit. Let us also recognize that the issue is not just infrastructure, but the ecosystem around it. Studies show that many girls are unaware of menstruation before their first period. Imagine experiencing that in a school that offers no support, no conversation, no safe space. So even when infrastructure exists, stigma silences its use. Now let me take you briefly to Kerala, which offers us an important point of comparison here. Through initiatives like the She Pad project, schools have introduced sanitary product distribution, disposal systems, and awareness programs. There have also been efforts to promote sustainable alternatives like menstrual cups. This shows us that schools can, in fact, be designed differently. They can acknowledge menstruation rather than ignore it. But even Kerala is not without gaps. In vulnerable communities, significant proportion of women still do lack adequate menstrual practices, which tells us something important. Policy innovation alone is not enough if deeper inequalities and social norms remain unchanged. So what do we need to do specifically for schoolgirls? Firstly, we must move from infrastructure on paper to infrastructure in practice, ensuring that every school has functional, private, well-maintained, and water-equipped toilets. Second, menstrual needs must be built into school design itself, including their disposal systems, the emergency supplies, and the safe spaces. Third, we need integration across policies so that sanitation, health, and education do not work in isolation. They do not remain in silos. We need them to be integrated and work together. Fourth, menstrual education must become normalized within the schools so that girls are prepared and the stigma is reduced. Adding on to what Abhinandan said, basically boys should also be included in that so that if a girl isn't prepared, he can probably help her out as a friend. And finally, we must listen to the schoolgirls themselves because without their voices, policy will continue to design solutions that do not match their realities. So let me end with this. A school is meant to be a space of learning, safety, and growth. But for many girls, it becomes a space of anxiety, discomfort, and exclusion. for a few days every month. And those few days are enough to change the course of their education. So the real question we must ask is, are our schools truly inclusive, or are they inclusive only for those whose bodies they were designed for? Because until a girl can walk into her school every single day of the month without fear, without shame, without barriers, we cannot claim that we have built an equal education system. Thank you.
Thank you for such an insightful session and for inspiring us with your journey, Shubhangi. Let us now have Arumita Mitra, a dynamic social entrepreneur, a TEDx speaker, and a community builder who has been at the forefront of driving meaningful social change in India. As the founder of Sadhamta Foundation and a leader associated with institutions like the Oriental Chamber of Commerce, she has worked extensively across rural development, education, and mental health, focusing on grassroots interventions that create lasting impacts. Her approach combines empathy with strategic thinking, ensuring that development is not just theoretical, but deeply rooted in lived realities. Please welcome her.
Yeah, thank you so much for this, wonderful introduction, Anam, and to Sarkari School and Vida Foundation for organizing this, much needed discourse. Because even though we are in 2026, we are still much behind, I feel, in terms of, menstrual health and hygiene. Because India is not just the cities, India is the rural India. So, firstly, good afternoon, good evening to all my friends. I am Arumita, and as Anand was describing, I come from a sector where we execute all the policies. So, a lot of you who have been, working on policy advocacy, so we run Samantha Foundation India, an NGO that is closely working for the last 3 to 4 years on ending period poverty in all over India. So what do we do basically? We have seen that going to rural places in India, when we talk about menstrual taboos at first, even the first time when we started our awareness programs, we saw very less participation because of course this being a taboo, a big stigma still in the rural India and something that's very hushed about, something that is talked about as bimari or a disease that happens to every woman. So we initially we faced a lot of problems to get women, and this I'm talking about 3 to 4 years back, not like 20 years back. But our journey, like when I was a student of Jadavpur University in Calcutta, we started this movement when I was in my university. It's called the Pad Against Sexism. So I'm just giving you a back, a drop where how we came here to do. So in Instagram, if you remember all of you, when it was 2013-14, when Instagram just came into action, so there was this lady from Mexico. She uploaded a picture of her with menstrual state, stating that the difficulty of women, having the stain in public areas, and she wrote a very nice narrative. And Instagram deleted it, saying that it violates the community standard. And that erupted a movement from Mexico that traveled to Jamia Millia University in Delhi. And there again, students talked about this movement, and what they did, they wrote anti patriarchal messages on the sanitary napkin. So this is 2015 when girls were taking out the sanitary napkin from the packets and were like sticking out on the walls, writing messages. And we also adopted that method and we did the same kind of movement. And we were showcased with the same, discussion that it violates the community guidelines and it's not something which is acceptable method of movement. Everyone is like, oh, you're doing a very good awareness program and all of that. But the method of the movement is not right. So, point of doing this was only and only to give that boost that the stigma is still there. It is not the menstrual health and hygiene, it is the stigma that leads to all the problems that we still have. Now, cutting back to what we are doing. So that journey was 2015 where I started my social work and I became a social worker myself. And then 2023 we founded the Hon'ble Foundation. So the one thing I will tell you at first is that there are two models of executing policies. One is ending period poverty by just distributing sanitary napkins in the villages. That we first, employed when we started that method. Why we were seeing that, let's say if I'm giving two sanitary packets to a woman in the village, she's using it for those 2 months, and then the next month they're again going back to what they were doing, the most unhygienic methods they were practicing, and so much that in my experience of working in menstrual health and hygiene for 10 years, I've seen women in the villages use wood dust, not even the dirty clothes, wood dust. So that is fatal. So then we changed our execution model and then we met the whole awareness program model. So what we did, we collaborated with the block development officers. We told them to get women and we told them that we will give them, of course, the food. Of course, the biggest issue in our country is hunger. So you have to give them food. So we gave a message that we'll give you food. We will give you sanitary napkins, but you have to attend 1 hour of the awareness program. And then, while talking to the women, we would ask very basic questions. Like what? That you are earning 100 rupees a day. Do you use 20 rupees to buy a napkin? They said no. I said then if you know that this buying sanitary napkin and using and maintaining menstrual health in your life would be not just better for you but your family as well. Because if you are safe and you are healthy, your men around you, even the children, the husband, they are also healthy. And then we saw the drastic change in our R&D that those specific areas where we were working, it changed that the demand of sanitary napkin in the local shops rose. So that is a very specific, annual report of our 2023 mentions that the spike of the sale. Because the awareness is something that sustains. Our donation model worked, but it never worked in a long term. But when we started our awareness program with all your blessings, we have distributed more than 1 million sanitary napkins, conducted more than 1,200 awareness programs in 13 states of India and multiple districts. So now, when I want to talk about some changes with respect to the schools, because as we are talking about a specific topic here, now girls they quietly skip schools every month. A lot of speakers have talked about this. And I've also seen them using unsafe alternatives because sanitary products are, of course, unaffordable. At first, they had GST, plus it's very expensive. A packet of sanitary napkin is not something that is very easily available to someone from a village. Now, I've also seen bright students slowly drop out, not due to the lack of the ability, but of course, the lack of support. Now, what's the most painful part is that our literacy rate of our country is directly related to the menstrual
Rumika,
health. Yes.
kindly summarize the speech.
Yes, I'll just wrap it up. So, the direct relationship between the health of a student, the menstrual health of a student, depends on a literacy rate of our country because more the school dropouts and less the girls are getting education. So, of course, a lot of speakers have already told them one would be my, according to my opinion, is school level intervention because, of course, the development is a necessity. Then we will need community engagement. That I feel, according to me, is absolutely non-negotiable because stigma does not begin in school; it begins in the home. With all our mothers or sisters who are also stigmatized, who tells us. And then consistent access to affordable products. I think in India, no matter how much of policies that you have, you bring the whole awareness on making the products affordable. See, a child is in school, but then she doesn't remain in school forever. So again, working on the policy level to make the products cheaper. And yes, education must be also practical and inclusive where menstrual hygiene should be a chapter that also I have been also working on that same policy and also the dignity because the dignity of a woman also lies with the menstrual health and hygiene and teachers, especially the teachers of government schools, they are very regressive as per my experience. They should also be much more, be holistic in their approach that even if she is having a menstrual health and hygiene issue or as a stain, the teacher should support. And all the speakers have already talked about the access of the menstrual aid is absolutely in the need of our.
Okay, thank you so much, Arumita. That was quite a meaningful session, and you gave us so much to learn from. So, thank you once again. It was lovely hearing from you. Now, next, I would invite Janvi Vyahurti from Andhra Pradesh, who's currently working as a fundraiser with Life Cause Foundation and a writer with the Borgen Project. Um, with her with her involvement in the NCC and creative pursuits, she represents dedication and social commitment. Now, let us all welcome her over here. On to you, Janvi.
Thank you, Anand, for your brief introduction about me. Good evening, everyone. Um, Before I begin, I'd like to sincerely apologize for not being able to join earlier. I'm currently attending my NCC camp, and due to network issue, my camera wasn't functioning properly. Thank you for your patience. And in a way, being here at camp connects deeply to what I'm about to talk today. I spent the last 4 years as an NCC cadet, marching on grounds, attending camps, standing in a co-ed environment. In NCC, we are taught to be prepared for anything, like literally anything and everything at every time. Injuries, emergencies, even bleeding, wounds. But there's one kind of bleeding that we never really prepared to talk about, menstruation. Not because it doesn't mean, but because it feels awkward. And that silence falls up everywhere on parade grounds where a girl pauses through cramps without saying a word, pushing herself constantly. At camps where hygiene becomes a quiet struggle. In NCC, unfortunately, it's still a privilege. In classrooms where the question which we want to ask remain unanswered. And on the other side, boys aren't insensitive. They are just never informed. So we end up in a system where girls silently manage, boys silently avoid, and the basic biological reality is ignored. And I want to share something from my own experience. In an NCC camp, which lasts anywhere from 10 days to 45 days, every single day we have at least one awareness session, sometimes 2 to 3 hours long. We learn about discipline, leadership, health, social responsibility, and how we can protect ourselves and our environment in basic. We are trying to become aware, responsible citizens, but in all those hours and all those sessions, I don't remember a single word or a single sentence about the menstrual cycle. Not one. And that's not just surprising. It's a gap because in a system designed to build awareness, measure something this fundamental, then what are we choosing to leave on? But here's the truth. The menstrual cycle is not just about periods. It's a health indicator. Irregular signs, severe pain, extreme fatigue. Sometimes they cause a permanent damage, like PCOD and PCOS. They are not things to adjust to. They can signal anemia and hormonal imbalance, creating a female to struggle in silence forever. However, this system must change. Ignoring them doesn't make us stronger, it delays care. So the real question is not why is this not happening? The real question is what can we do differently? So the first thing is to not normalize the conversation. If we talk about injuries with everyone, then we must talk about menstruation too, without jokes, without whispers. Second, include voice in awareness, because awareness that excludes half the population doesn't work. And third, ensure access to hygiene. Sanitary products and clean washrooms should be the basic and not the privilege. Fourth, listen to your body, not to what society would think. Pain is not always normal. Irregularity is not something to ignore. Speak up to yourself, to your body, and not to people. No matter where you are, what you are doing, when your body needs rest, you need to rest. There's no more second thoughts after that. Seeking help is not weakness, it's a responsibility. And finally, lead by
Janvi,
example.
kindly
Yes, ma'am?
conclude.
Yes,
Kindly conclude your speech, please.
yeah, I'm really sorry for taking it so long. I will conclude.
No
So,
issues.
yeah, okay. So, am I audible to you?
Yes, John, you're
Yes, you
audible.
are.
Yeah, thank you. And finally, to conclude the speech, we are trying to protect, to lead, to serve. So let's start here by respecting, understanding, and normalizing something this fundamental. Because the real strength is not ignoring reality, it's facing it. And thank you for giving me this wonderful opportunity for the Sanskari School and Anand for guiding me.
Okay, thank you so much for the inspiring words and it, Danny. That was pretty impromptu and I could feel it. So kudos on that. Now let's all welcome Devalina Das, who is a philosophical student at Cotton University in Guwahati, Assam, with a background from Kendriya Vidyalaya. Passionate about human behavior, ethics, and critical thinking, she actively seeks research opportunities in public relations and social communication. Devalina aims to bridge the gap between philosophical theory and real world issues through interdisciplinary studies backed by skills in research, presentations, and analytical thinking. Let's all welcome her. Devalina, if you're very good, go ahead.
Okay, first of all, I would like to thank Sarkari School and Anam ma'am for inviting me as a speaker and giving me this wonderful opportunity. So, good evening, everyone. Today, I want to speak about something that is entirely natural, but we are often surrounded by silence. That's menstruations. And my central argument is that menstruation stigma is socially constructed, that's not biologically justified. And it continues to affect our health, education, and our dignity. To begin with, I would like to give some stats, if it's okay. According to NFHS 2019 to 21, only 64% of women in India use hygienic methods of menstruation protection. Approx 36% still use traditional and unhygienic methods. So, according to UNICEF and other studies, have also highlighted that many girls miss schools during their periods and due to lack of proper facilities, stigma, or discomfort. This is not just a health issue, it is an educational as well as social barrier. Now, let us turn to science. Menstruation is a normal physiological process. It occurs as a part of menstrual cycle, typically every 21 to 25 days when it treats its lining if the pregnancy doesn't occur. This process is regulated by hormones such as estrogen and progesterone. Don't know like the I don't think my pronunciation is clear though. There is nothing impure, unhealthy, or unnatural about it. It is a sign of functioning reproductive system. However, despite the scientific clarity, social perception tells a different story. Psychologically, stigma is learned, through repeated message, being told to hide, to feel unclean, or to avoid certain spaces such as temple or etc., and to avoid some foods like pickles and etc. Individuals begin to internalize shame over the time. Something normal starts to feel uncomfortable. Philosophically, this raises an important question. What does impure really mean? If menstruation is essential for the continuation of life, then labeling it as unclean is not logical, it is constructive. Historically and culturally, these ideas have roots in certain interpretations of texts and mythological narratives. Over the time, such interpretations shape social practices, restrictions, isolation, and expectations of purity. But these beliefs have often continued without being critically questioned. To understand the real impact, consider a simple real life scenario. A young girl experienced her first period without any proper knowledge. She is told to enter, not to enter certain places like temples and all, lacks access to sanitary products and misses schools. She feels confused and ashamed, not because of biology, because of the environment around her. This is not exception. It reflects a widespread reality. From a sociological perspective, this practice is persists because they are normalized. People follow them to avoid judgment, silence, and silence continues across generations. From a feminist perspective, the issue is deeper. When individuals are made to feel ashamed of their own body, their autonomy is limited. Challenging menstrual stigma is therefore not just about hygiene, it's about dignity, equality, and right to access without any unnecessary restrictions. So, what must change? We need an accurate menstruation education, accessible and affordable hygiene products, better sanitation facilities. Most importantly, open conversations. Silence must be replaced with awareness, and myths must be replaced with science. Because menstruation is not a problem, the silence around it is. And before I conclude, I want to say something personally. I'm currently on my periods, and I say that without any hesitation, without any shame, and without any discomfort. Because this is biology, this is natural. In fact, it is a process that makes human life possible. Every one of us is here because of it. So I would like to ask something. If something so fundamental to exist, why should it ever be hidden? Thank you.
Thank you so much, Devalina. Now, I would like to have Anusha, a dedicated student at Indraprasth College from of Women, University of Delhi, pursuing a BA in political science. An accomplished writer, a researcher, she was a top five finalist at the Indian Film House Award 2025 and a co-author of two poetry books. Currently a human researcher intern, Anusha actively contributed to public policy, social cause, and uh, an edited team. Let's welcome her.
Thank you, Twinkle. So, yes, I'm Anusha, and today I'll be covering justice in India. Who is still left behind now? The previous speakers have already spoken about it pretty adequately. I'll just add a few points. So when we talk about health in India, we often talk about the good things that are happening. We talk about the maybe the schemes to give out pads, the campaigns to raise awareness, and the toilets that are being built in schools. But we often neglect a very important question, that is, who is still being left behind. Now, menstruation is not same for everyone. For example, if there is a privileged student in an urban private school, a period may mean discomfort for a few days. But what about a girl who is living in poverty, who is a Dalit student facing social exclusion, or maybe a child with disability? For them, menstruation can become a barrier to education, dignity, mobility, and health. So, today I want to argue that menstrual access is not only a health issue, but it is the issue of equality, inclusion, and justice. So today I was searching for some reports regarding menstruation, and I found that India has over 355 million menstruation women and girls. Yet, many adolescent girls, they still lack safe access to safe and hygienic menstrual products, especially in rural and low income communities. And millions of girls in India, they face challenges managing menstruation safely due to inadequate sanitation facilities, stigmas around it, etc. So one of even more concerning issue is that government and NGO reports repeatedly show that school infrastructure often fails the a girl child with disability entirely. Now, imagine being a student who uses a wheelchair in a school where the washroom has stairs but no ramp. Pretty unbelievable, right? But that's the reality of India. So, and these inequalities become even sharper when caste and poverty dynamics are added to the picture. A study again by Dasra found that nearly 23 million girls in India drop out of school annually due to lack of proper menstrual hygiene, management, and inadequate facilities. Whether the exact number might fluctuate, but the message is clear, that is, menstruation continues to disrupt education for millions. And the girls most affected are often the least visible in the policy conversation. For example, the Dalits, or the disabled girls, etc. So even when schools and colleges distribute sanitary pads, many fail to provide what actually enables dignity. For example, you can say functional toilets, running water, disposal systems, privacy, disability access, and safe environment, and free from shame, the stigma around it. So now, to address these problems, I have basically curated some of the policies that I found to be pretty adequate. For example, first is every school in India should adopt disability inclusive menstrual structure. It can include accessible toilets, ramps, hand washing facilities, emergency menstrual products, etc. Again, these are very basic amenities, but we still consider them to be a privilege, right? So these things need to change. Secondly, menstrual education should become a very important part of the curriculum of all the students, including the boys, as mentioned by one of the speakers earlier. Because silence basically creates stigma, and stigma creates exclusion, which today we as women are facing, let alone the women who are underprivileged. Third is India needs intersectional policy planning. That is, data collection should track not just how many pads are distributed, but who still lacks access based on disability, caste, geography, and income. And fourth is local communities must become partners in change. ASHA workers, NGOs, self help groups, teachers, and youth volunteers should all come up together and can help, so that they can help bridge the gap between policy and reality, especially in remote and marginalized areas. Because inclusion cannot remain a line in policy documents, it must exist in classrooms as well. it it should be included in the school budgets, in the infrastructure, and in the way we treat every girl's dignity. So that's all from me. Thank you so much.
Thank you so much for your remarkable insights and for your session. Now, I will like to call Gauri Joshi, a dedicated third year law student at Government New Law College, Indore, pursuing BA LLB. She has gained practice legal experience through internship at the High Court of Madhya Pradesh and Family Court. Let's welcome her.
Thank you so much for having me over. Good evening, respected dignitaries, fellow speakers, and everyone joining us today. A period should end a sentence, not a girl's education. So today I'm basically speaking about the transition from courtroom to the classrooms. When the Supreme Court delivered its landmark judgment in Dr. Jaya Thakur versus Government of India, it did more than recognize menstrual health as a matter of hygiene. It placed menstrual dignity within constitutional framework of life, education, equality, and dignity. That is Article 21 and 21A. But rights declared in classrooms do not automatically transform realities in classrooms. The real question before us today is, how do we measure the menstrual justice as merely promise but practice? India has made progress through policy. Yet policy alone is not enough if implementation remains invisible. We measure GDP, we measure literacy, we must we measure even digital growth. Why are not we measuring menstrual dignity? If we truly want change, India must move from taboo to tracking. We need a menstrual accountability model, one that ensures every school is not only aware of menstrual rights but answerable to them. And this begins with the data. Every school should be assessed through a national menstrual index based on practical indicators, that is, availability of sanitary products, functional washrooms, water, soap, privacy, disposal systems, teacher preparedness, and menstrual education for both girls and boys. Because what we do not measure, we do not improve. Second, every school should publish menstrual accessibility report cards. How many girls miss school during menstruation? Are pads dispensers functional? And are facilities usable for students with disabilities? With accountability, policy risks becoming symbolism. But there is another critical gap that we often ignore. That is representation. Women constitutes nearly half of this nation. Yet, if we look at parliament, women's representation remains around 14 to 15%. And if policy making reflects representation, then we must ask, can policies concerning women's body truly be completed when women themselves remain underrepresented in decision making spaces? As Rachel Green famously said in Friends, no uterus, no opinion. While humorous, this reflects a serious democratic truth. Menstrual policy cannot be designed effectively without lived experiences, voices, and leadership of women. This is why India needs greater female representation not only in parliament but in every level of menstrual policy making, from national committees to school boards. Because menstrual health is not simply sanitation issue; it is an educational issue, a government issue, and fundamentally a representation issue. We need student-led awareness groups, menstrual ambassadors in schools, and youth participation in policy feedback system. The Supreme Court gave India a constitutional foundation. Now it's our responsibility to build a structure. Because true progress will not be measured by how politely we discuss menstruation, but by whether no girl anywhere in India has to choose between her biology and her future. And to conclude, I just want to say that मैं वो नहीं जो सिस्कियों की गोद में पनपती है, मैं वो हूँ जो एक पैर के फेरे से दुनिया को पलटती है. Thank you so much for having me.
Thank you so much, Gauri. I really appreciate the quote you have said. Let's have Sanji, a dedicated BA LLB student at Manipal University, specialized in Indian law and privacy, Secretary General of the Care and Share Initiative. She led Inspired Community Outreach Project. Her legal foundation is by multiple internship in documents drafting, and research. Please welcome her.
Yes, am I audible?
Yes,
Okay, greetings of the day to one and all present here. I would like to present my speech on menstrual health, a youth policy, and how it affects the young women and the girls in the schools. As we all know, menstruation is a completely natural and biological process, but it's still seen as a taboo. It's still seen as a stigma in many parts of not even in the rural area, but the urban areas. When in our NGO we go to the slum areas, women still seen it as a disease and as a disorder. The women are not open up to talk about these issues. We, for the menstrual health, have to do much of the implementation and have to make it as a normal and common thing. As we all know that menstruation is not a stigma or a taboo. We have to make multiple of the implementations which are applicable at the grassroots level, which are applicable in the school. If we see and go to the private schools, I repeat at the private schools, not even in the government schools, women don't have the knowledge. The basic girls don't have the knowledge about what periods are and what should they do during their periods. It's a thing which have been conducted by our NGO and by different schools. And many of the girl child leave their schools. Many of the girl child stop going to schools during that period of their days. And to implement these things, there are a few of the initiatives. Firstly, we have to stop making it as a taboo or as a stigma. We have to openly talk about the menstruation, even when there are people of opposite gender or opposite sex. We have to make implementations. We have to make the good toilets. We have to make good places where the girls, children could go. We have to provide the women in the slum areas, the women in our faculties by basic pads and basic menstrual health awareness camps. We have to provide them the knowledge about how to use the pads and what are the things. We have to make the basic knowledge that being on your period doesn't mean that you are impure. Being on your period doesn't stop you from doing any work. If we see the recent applications or the recent laws related to periods don't support the women, but that's where the grassroots level or that's where the non-government organizations or the new generation could make a change. That's where we as a society could make a change and make the menstruation a thing which is more of a thing which people can talk about. Lastly, I would like to say that for the implementation and for the knowledge of the menstrual cycle, we have to make and put the basic knowledge and put it into each of us that menstruation is a sign of the new life. A menstruation is a sign of new biological life. It's not a disease. We should each respect and give period leaves to the women who are on their period cycle. Lastly, I would like to thank for this.
thank you so much for your encouraging words. Uh, I want to just say that kindly switch on your cameras, all of you. We have to take a pic.
Not right now, guys. We can do it at the end as well, when everyone's done with their speeches. Twinkle, we'll do it at the end. You can continue with the next speaker.
Okay. Now I would like to call Mansi, an international relations student at Jamia Delhi with an keen interest in global politics, geostatics, and emerging technologies, and BRICS International School 2026 participant and Miss Fresher 2025 title holder. She contributes academic deep with a real world skilled in research, diplomacy, and content creation. Mansi is a Mansi is a found thinker, young professional, explorer how AI and global system are reshape our world. Please welcome her.
Good morning, everyone. I would like to, first of all, I would like to thank Sarkari School for giving me the opportunity to speak about something that truly matters, menstrual health. I want to tell you about something that happened in my classroom when I was in school. No boys present, no male teacher, just a classroom full of girls and a woman who was supposed to be our educator. My classmate had asked girls for a sanitary pad and the teacher slapped her. The slap was so loud that every girl in that classroom learned that your body is something to be ashamed of. I'm Manisha Kandari. I'm a first year international relations student at Jamia Hamdard University. I study how policy either protects people or fails them. But before any of that, I was a girl sitting in that classroom, watching, staying silent because silence felt that silence was the safest thing to do. I have thought about that day a lot. And here is the one thing that menstrual health is not a sensitive topic, silence is. We already have the data. In India, 1 in 5 girls drop out of school just after her first period. Not because she wants to, but because no one has ever told her that what is happening to her body is very normal. We know all of this. The numbers are there, and the numbers doesn't change anything, but the stories do. That teacher, I don't think she is a bad person. She is really not. She was just someone who was never taught differently. Nobody has ever taught that a pad is just a pad. Nobody has ever taught that a girl asking for a basic hygiene isn't doing something wrong. So she passed on the same shame that was passed on her. And that is exactly the cycle we need to break, not by blaming individual, but by fixing the system that keep producing the same result. So what does fixing it actually mean? Let me be specific. First, what we teach in school. Menstrual cannot be just a one awkward topic in class 8 biology textbook that teacher rush through because they are uncomfortable. It needs to be a real conversation starting young in an age appropriate way. Not just the science of it, but the dignity of it. The girls need to grow up knowing that their body are not a problem to be managed in secret. Second, basic infrastructure. Every school should have the clean and private washroom and accessible to the pad. And there should be a place to access pad that is not locked away somewhere with no one having the key. This is not asking for too much. This is the bare minimum. Third, training for teachers. If an educator can slap a student for asking for a pad, she is not a bad teacher. It's a system failure. That is a system that never prepared her for that moment. Teacher need proper ongoing training, not a 1 hour session that gets forgotten. Fourth, making sure that our policies actually work. India already has frameworks and schemes for menstrual hygiene. They exist, but a policy that only lives on paper no one helps. We need to ask, is this actually reaching the girls and is anyone checking? These are not a big or impossible demand. These are basic ones. And in fact, we are staying fighting for them says everything. I'm not here because I have all the answer. I am here because I remember that day in my classroom. I remember the sound of a slap and I remember the silence that followed. And I think it is the time we made enough noise together consistently without apology that no girl has ever to ask for a pad in whisper again. The silence and here. Thank you.
Thank you so much, Mansi, for a personal experience. Now I would like to call Zeenat Ali. Zeenat Ali is a driven student pursuing a BA in International Global Studies in Jamia Ahmed, Delhi, with a strong foundation in international relation theory and multilinguistic in English and Arabic. She brings a global perspective to everyone she does, a confident communicator, and a natural team leader. Zeenat Ali combines academic with practical skills in presentation, teamwork, and research. I would like to call Zeenat.
Am I visible? Am I audible?
Yes, you are, Zeenat.
Okay, wait. Can't see my camera. Wait a minute.
Sure.
Hello everyone, I am Zeenat Ali doing my bachelor's in international relations in Jamia Hamdat University. Okay, so the law has finally spoken. Supreme Court of India have made a declaration that menstrual health and hygiene is an integral part of a girl's right to life, dignity and education. But I want to ask, क्या हमारी सोसाइटी ये फॉलो कर रही है? क्या हमारे घरों में ऐसा है? क्या हमारे स्कूल्स में ऐसा है? Can we notice this? Can we? इसलिए I am here on this platform to talk about this gap of what the law says and what a girl actually experiences. Firstly, menstrual health is not just about the blood coming out of your body. It's a major shift from mama dolls chahiye to pads khatam ho gaye. So I think it includes three major factors which are physical. It includes sanitary sanitary products and hygienic facilities. इसके बिना एक लड़की की health directly risks पे. Emotional, not feeling ashamed of something natural. This shame causes low confidence, anxiety, and fear. Social, it's about the environment around her. It includes her family, friends, classmates. She internalizes it as a shame if someone is not talking about it openly, if someone is not comfortable around her about this topic. And I would like to talk about my experience when I got my first period. There was silence around me. I got my period at very early age. I got my period at very early age, and there was silence around me. I had many people around my I had many people in my home, Ammi, Chachi, Dadi, Khala, Nani, but no one considered the topic menstrual hygiene important enough to tell me. I literally thought मैं मरने वाली हूँ, and I was not aware about periods. I was not aware about periods. Literally, I had zero information. But when I grew up, I realized what it was, etc. But now I think जब घर में silence, जब अपनों के बीच साइलेंस ऐसी फेस करनी पड़ती है, तो लड़कियों को स्कूल्स में और बाहर कैसी साइलेंस फेस करनी पड़ती होगी. और यही साइलेंस स्कूल्स में भी जा रही है. In our school, menstrual is treated as an invisible issue. Girls hide pads in their sleeves, excuse themselves from class with vague reasons, and sit through pain without saying a word because nobody ever gave them that safe place to speak about it. NGO दरसा की रिपोर्ट के मुताबिक हर साल 23 मिलियन, आई रिपीट 23 मिलियन लड़कियां स्कूल छोड़ देती हैं क्योंकि स्कूल्स की मेंस्ट्रुअल हाइजीन फैसिलिटीज़ अच्छी नहीं होती है. एंड नाउ आई थिंक दिस इज़ नॉट अ हेल्थ इशू, इट्स एन एजुकेशनल क्राइसिस. क्योंकि जब एक लड़की अपने पीरियड्स की वजह से स्कूल नहीं जा रही है, वो तो उसका नुकसान है ही, पर एक ये हमारे देश का भी नुकसान है. एंड दिस डिस्क्रिमिनेशन डजंट हैपन बिकॉज गर्ल्स आर वीक, इट हैपन्स बिकॉज आवर schools have failed to create a safe, informative and supportive environment. And I would like to give a cultural reference of a movie, The Padman, in which that guy, he has extremely prioritized his wife's health, even though the society criticized him badly. Menstrual health education should include both the genders, not just girls. And the Supreme Court recently stated that menstrual health education must be established in schools to create a safe place for both the genders. And sixth, clean gender separated washroom must be built and properly maintained. Third, health clubs must be established in schools to create a safe place for women to discuss openly and confident about the menstrual health and not feel ashamed. Fourth, menstrual health education must be included in curriculum and explained properly to both the genders. And sixth, schools counselor and therapists must be equipped to provide menstrual cramp and solutions and emotional support. And lastly and most crucially, schools must be regularly monitored by a higher authority so we can have the data if the schools are implementing these things or not. इन्हें implement करने के साथ normalization भी करना बहुत ज़रूरी है क्योंकि menstrual हाइजीन एक ऐसा टॉपिक है जो कॉर्नर में नहीं होना चाहिए. इट शुड बी डिस्कस एनीवेयर ओपनली एंड कंफर्टेबली. मेरे लिए नॉर्मलाइजेशन ब्रिंग्स दी biggest change in our schools and in our society. So at last I want to say that menstrual health should not be an embarrassment. It should be an embracement क्योंकि जब हम silence मिल पाएंगे. So that was it. Thank you for paying attention to this, and thank you Sarkari School for giving me this opportunity. I hope this creates awareness, affection, and love for menstrual health.
Thank you so much, Dina, for a personal experience and powerful session. Now, I would like to call Priyanshi Goel. Priyanshi Goel is an aspirant lawyer, is an incoming BA LLB honors student, a Toastmaker certificate communicator, passion debater, and MUN participant. She, she combines sharp analytic thinking with creative flaws in writing and sketching. Let's welcome her.
The most powerful change begins the moment we stop calling something unspeakable. I was 13 years old. I had experienced what it was like to be a woman just twice. But I already knew that was not something that my younger self imagined for her sweet teens. I was having a conversation with my friends at school, which steered its way from homework to relationships and somehow landed on periods. And that was when I got my first ever dose of obliviousness towards periods. My own guy friends thought that we bled for mere 5 minutes, and that was all there to worry about. I myself understood why I bleed for 5 days every month only at the age of 16. So, how can we expect the sensitization towards menstruation when those adolescent girls themselves are oblivious to the nature of their own body? A very good evening to one and all present here. I'm Priyanshi Goel. I extend my deepest gratitude to Sarkari School for giving me this opportunity. A period should end a sentence, not a girl's education. Today, girls as young as 8 years of age are experiencing menstruation. The age where time is meant to be passed playing with their friends. The age where schools must feel like their second cozy home. They are locked away from their friends and education in a corner of their own house, forced to use a shabby piece of wrap just so a blood stain doesn't show up, just because a society is still plagued by the deep-rooted stigma and taboo. Due to financial constraints and stigma, many girls lack access to basic menstrual hygiene facilities and are forced to use unsafe alternatives like old cloth, straw, or even ash. This not only leads to absenteeism and school dropouts, but also serious health risks, including infections like bacterial vaginosis that may even cause irreversible infertility. It's about bodily autonomy and decisional freedom as well. Then why is a girl forced to conform to the societal expectations from a menstruated woman for these 5 days every month? Does she lose her natural rights of being educated, of making decisions for herself, of having a dignified life then? A child shows the man as morning shows the day. The right to education is a multiplier right, opening gates to all the fundamental and natural rights given to every single human. But this gender based denial of quality public education becomes utterly incompatible with the Golden Triangle as enshrined in a constitution, the Right to Education Act, and multiple international laws and treaties. Why have we taken this long to address period poverty? Paucity of funds cannot be the ground for the state to deprive school going girls of basic facilities like clean washrooms, period products, etc. A survey in 14 Indian districts found that 83% of women are forbidden from visiting religious places. 72% are banned from participating in rituals and are not allowed to carry out routine household tasks while menstruating. Over 23% of girls drop out from school when they start upon menstruation, largely due to the lack of facilities and the associated stigma. We say that gender equality and periods have been normalized. The society has changed. But why do there still exist stigma and restrictions on bathing, touching objects, leaving the house, visiting temples, and performing daily chores then? How did something so natural become something that men avoid and women hide? Periods are not the problem. It's the deep rooted attitude and norm which a society is unwilling to break away from. Unless we transform the entire ecosystem, from rural to urban, from the mindset of a child to that of an adult, true equity for women will stay out of reach. It is therefore imperative to create safe and supportive learning environments for adolescent girls, free from stigma and lack of basic facilities. And this change cannot rest solely on governments or institutions. It must begin with each one of us. It starts by speaking openly, without shame or coded words, by including boys in the conversation, so awareness replaces awkwardness, by ensuring access, even small steps like keeping sanitary products available and demanding clean, functioning toilets, and by challenging stigma when we see it in jokes, in silence, or in discomfort. Because normalizing periods doesn't mean it needs to have grand gestures. It needs everyday courage to treat it like what it is. Pretty normal. Thank you.
Thank you so much, Priyanshi. Uh, I really appreciated the knowledge and the insight you have given. Now, I would like to have Shikha, a dynamic student, national level taekwondo player, and emerging content creator from Kendra Vidyalaya, a regional medalist and active court and guide member. She blends discipline with creative thought, creative through videos, arts, and writing. Passionate about growth and self-experience, she shared her journey to inspire learning, consist- consistency. Now, let us welcome her.
Thank you, Twinkle. Greetings everyone. I am Siksha Sanvi, a class 11 PCM student from Kendra Vidyalaya, Bihar. Beyond my textbook, I live a moment of expression. I am an athlete, an artist, and a content creator. Whether I am on the track, at a canvas, or behind the camera, I'm always looking for the truth. And today, I have come to this summit to speak about a truth that is often hidden to the shadows. Period, blood, gross, menstruation, secret. Why? A natural biological process that every woman goes through every month for about half of their life. A phenomena that is so significant that the survival and propagation of our species depends on it. Yet, we consider it a taboo. Every single person here exists because of the very cycle we are taught to be ashamed of. I want you to imagine a young girl. She's 12. She's scared. She has just realized her body is changing. But instead of being told she's becoming a part of a powerful rhythm of a nature, she is handed a pad wrapped in a dusty newspaper and shoved into a black plastic bag. It is not just plastic, it is filled with the weight of don't tell your father. Don't go into the kitchen and don't touch the pickles. It is filled with the lie that she is suddenly impure. As a content creator, I see the power of digital voices every day. We are the generation that can turn period poverty into period power. We are the only ones who can tell the shopkeeper, no, thank you, I don't need a newspaper. To every girl here who has ever curled up in a ball, fighting the crushing waves of cramps while trying to pretend everything is fine, I see you. Those cramps are real, I see you. The exhaustion is real, I see you. When your body is working this hard to sustain the potential for life, it deserves rest, not a mask of toughness. Shame is a shadow, and shadows disappear in the light. Let's vow that no girl will ever have to feel gross for being healthy. Let's commit today to throwing away black plastic bags of our minds. Let's stop whispering. Let's normalize the conversation so that no girl ever feels she has to hide a part of who she is. Thank you. Thank you for having me. Hope you all liked it. Thank you.
Thank you so much, Sakshi, for your heartwarming words and adding deep to the discussion. Now, I would like to call Tanu Shokeen, a dedicated political science scholar currently pursuing a master degree at DU with a solid foundation from BA in the same field. She has honored her experience. She completed a remote internship at a Sarkari school where she specialized in online research, demonstration a strong commitment to impact social governance. I would like to call her on the stage.
Thank you. Thank you for having me here. So, hello and good evening to everyone. So, as my fellow speakers have already given such an insightful view on the menstrual health, I would like to go deeper into the topic beyond toilets, ensuring dignity, privacy, and usability in school infrastructure. A girl misses school 5 days every month, not due to illness, but due to silence, stigma, and lack of support. This is where our conversation on menstrual health must begin. Today, we move past the simplistic measure of SS. For too long, the success of school sanitation has been measured on the mere existence of toilets. But if a girl stands outside that stall, paralyzed by the fear of a broken lock, or if she chooses to stay home because there is no discreet way to dispose of a sanitary pad, then the infrastructure has failed her. But thus, the mere existence of infrastructure gives dignity. In both the rural and the urban context, menstruation remains a shadow issue. In rural settings, it often scarcity and distance, while in urban, it is overcrowding and neglect. However, the common driver is the stigma. According to me, there are three lens you to the situation. First, privacy as human rights. So, privacy is not just a door that shuts, it is a psychological safety of knowing one's body and its processes are shielded from the gaze and judgment. Second, instability beyond the doors. A toilet is unusable for the student if there is no source of water, no shelf for placing clean materials, and no mirror to check for stain. Third, dignity in disposal. The shame of carrying both the unused and used product of a stall is the primary driver of school absenteeism. Dignity requires point of use disposal system. Thus, moving from policy formulation, we require a technology based solution. So, I will be proposing some of the solution which might include first, smart vending and dispensing. Installing intelligent technological enabled sanitary napkin dispensers allows for touchless and judgment free access. When a student can use a preloaded card to access a pad, the need to ask a teacher and risk embarrassment is eliminated. Second, decentralized waste management. In rural areas where sewage systems are non existent, technology offers green incinerators or small scale anaerobic digesters. These on site solutions ensures that menstrual waste is managed instantly and discreetly, preventing the clogging of pipes and the environmental hazards of open dumping. Third is the digital literacy. We can utilize mobile technology to bridge the information gap. AR modules or anonymous AI driven chatbots can provide rural and urban students with private, accurate menstrual health education, effectively bypassing the cultural taboos that keep teachers silent. One of the most important steps could be the publication of reports and data regularly to see that that the implementation happens on the ground or just the papers, bringing in accountability. Thus, I will end this discussion with two of the most celebrated political thinkers. First is Amritya Sen, who gives the idea of substantive freedom and capability building requires not just infrastructure, but the capabilities that allow a girl not to be deprived of her capabilities to learn, to participate, and to thrive. Similar to him is Michael Foucault, who gives the concept of power. Thus, I argue that silence around menstruation is not neutral. It is produced through power relations that regulate bodies, knowledge, and discourses. The school can offer not just a site of learning, but they are the site which silence are reproduced and can be dismantled too. So, with this initiative of Sarkari School, I'm very privileged that I was here to be a part of it and become a voice of youth. Thank you.
Hey, thank you so much, Tanu. That was amazing. Loved hearing you. So now we'll begin with our concluding statements. 25 voices, 25 perspectives, and one undeniable truth.
Today, we didn't just talk about menstrual health. We dismantled the silence that have surrounded it for generations.
We have heard the data, the stories, and the solutions. But more importantly, we have felt the energy of a room and a digital community that refuses to accept hushed voices as the status quo anymore.
To our speakers, researchers, and change makers, thank you. You have shown us that while, while the barriers of our schools, the lack of infrastructure, the misinformation, the systematic gap are real, but they are not permanent.
They are challenges waiting for the courage of people like you to solve them.
As we bring this summit to a close, we must remember that the end of this session is not the end of the mission.
The real work begins when we log off.
It begins when we walk back into our classrooms, and reform to use code language.
It begins when
It,
you
bri-
advocate for a sanitary pad vending machine in a government school or a clean washroom in a rural block.
it brings when you choose science over stigma.
And empathy over embarrassment.
We start today by asking why.
Why the shame? Why the silence?
After hearing all of you, we end today with the different word how.
How do we sustain this momentum?
How do we ensure that the next generation of students doesn't have to check their uniform in fear?
How do we make menstrual dignity a right and not a luxury?
The answers lie in the collaboration formed today. They lie in the policies discussed and the awareness spread.
We want to extend our deepest gratitude to the entire organizing team for giving youth voices a platform where they are not just heard, but valued.
To participants who stayed with us through the 25 incredible sessions. You are now an ambassador for this cause.
Carry these solutions with you, speak them loudly, and write them clearly.
Because when we replace silence with solutions,
We don't just change a conversation.
we change the world.
Thank you for being part of the journey, and we'll now request everyone to switch on their cameras for the final group photograph. All right, Twinkle, would you be comfortable taking the picture?
Yes.
All right.
Thank you so much, everybody.
Okay, thank you so much, everybody. Have a good night. Thank you for being here.
Good night for being here.